And I'd like to welcome you to ICN Presents. The Interagency Council of Norristown brings you these programs in an effort to better educate the greater Norristown community on certain issues that have bearing to you, the residents of Norristown. Today we are concerned with overall wellness within our community, and we're looking at two areas, one dealing with young people and one dealing with young mothers. And I'd like to introduce our two guests. On my right is Dottie Shell, who is a registered nurse in the Norristown area and also teaches childbirth and parenting classes for Child Home and Community in Norristown. She is also a volunteer consultant for the Pennsylvania chapter of the American Academy of Pediatrics and works on breastfeeding initiatives and secondhand smoke projects. She's also a volunteer with the March of Dimes. To my left is Melissa Berry, who is a clinical manager nutritionist at Montgomery Hospital. Melissa travels to Norristown each day from Glen Mills to work in our community. And basically she is a registered dietitian. So we're going to learn something about good eating, food habits, and early childhood training. So first, Dottie, I'm going to turn to you, and you have a little character with you here in your arm. So how important is breastfeeding for a baby?
Well, breastfeeding is actually the very first immunization that a baby gets. So when the baby is born and the mother begins to nurse the baby, it protects the baby from a lot of illness, particularly right now with the flu. It's believed that breastfeed babies, we can't guarantee they won't get the flu, but they're likely to be able to fight it better than the baby who's not breastfed. Plus, it protects the baby from a lot of other illness. In addition to that, it's really the first step to optimum nutrition. Mother's milk is made specifically for the infant, and you really cannot overfeed a breastfed baby. So the very first step to prevent obesity and make sure your child, is nutritionally healthy is to breastfeed.
And what about the mother who is unable to do this?
Okay, the mother who is unable to breastfeed, most women actually are able to breastfeed. There are very few reasons why a woman cannot breastfeed, and she should discuss while she's considering a pregnancy and while she is pregnant, she should discuss this with her obstetrician, and if there is any question, contact a lactation consultant, because she just may need some special help. For the very few who might not be able to, then certainly bottle feeding is a good choice. It does offer the child excellent nutrition. It does not offer the immunity factors that the breastfeeding does, and it's not made specifically for the baby, but it does offer the baby very good nutrition. And she should be supported with that and not to be made feel guilty for not being able to breastfeed. It's how she mothers her baby that is the most important.
Not having experience with this, what is the time frame for breastfeeding for a young parent?
Well, basically, the American Academy of Pediatrics recommends that all babies be breastfed when possible, and that they can be totally breastfed for 6 months. That means they do not need anything else but breast milk for the first 6 months. Then solids are introduced. The Academy recommends that they be breastfed up until age 1. After that, and that would be breastfed plus getting solid foods, etc., after 6 months. After age 1, really, it's mutually agreeable between the mother and the child. Now, some mothers may choose to breastfeed that long, some do not. Here in Norristown, we have between 50 and 60% of young mothers breastfeeding. Many will only breastfeed for a few weeks and then wean. In Montgomery County, generally, the numbers are higher than the borough of Norristown. There are about almost 80% of women will breastfeed. So really, it's a choice between the mother and,
Now, is there, not quite sure how I can phrase the question, how natural is it, I guess, for the mother to know all this or get educated? Is it just through the doctor? I mean, you're quoting some statistics here in the Norristown community, so many percentages are doing this. How do you follow up on that, or how do you determine those percentages?
Okay, well, these percentages are basically the ones I gave you are from birth certificate data, and also the behavioral health risk survey that the Pennsylvania Department of Health does. And they also do surveys of the area hospitals to see how many women are beginning breastfeeding. As far as how a mother learns about breastfeeding, while she's considering a pregnancy, it's really important for her to learn about how to be healthy and to learn about breastfeeding while she's pregnant. Once she is pregnant, she can discuss breastfeeding with her doctors. There are a lot of support services. Each hospital in this community offers childbirth classes. In addition to that, at Child Home and Community at the Montgomery County Government Service Buildings, we offer parenting and childbirth classes for young mothers. So there's those resources. Each hospital has a lactation consultant on staff. And the Pennsylvania Health Department has a telephone number, 1-800-896-BABY, that a woman could call and find out what resources are available in her community. There are many lactation consultants in this community, as well as some lay support people for breastfeeding. So there is ample support. The new mother or the expectant mother, really, she needs to do a little bit of homework. Ask her friends and family. That's one reason we're doing this show today, so that the community can support her and guide her as to where she can get good information.
Now, in the Norristown community, in recent years, we've seen an influx of Latino population. How is the instruction capabilities in foreign languages?
Okay, well, Child Home and Community offers childbirth and parenting classes for Latino mothers. They're offered 6-week sessions, and you can find out about them through calling the Montgomery County Health Department. And each hospital, they have staff that are bilingual, so they can get information that way.
Okay, so the information is available then,
Yes.
if they want to
Yes,
use
it is very available.
Okay, great. Well, now, from a slightly different angle, you're dealing with people a little bit older.
Yes.
Today's world, most people are hearing and reading constantly about teenagers, their eating habits, their lack of eating habits. My wife and I are guilty of going to McDonald's every Saturday and Sunday morning for breakfast, and we see a lot of families with a lot of kids in there. What can you tell us as far as nutrition for young people? What should they be doing? What shouldn't they be doing?
Well, one thing that they can be doing is trying to develop those healthy eating patterns at a young age. And part of that responsibility, or almost all of that at a young age, is from the parents. What comes into the house is going to be key. And it's up to the parents to make sure that their choices are well-balanced, well-rounded, and healthy choices. Using the food guide pyramid would be a good example or a good guideline for parents to use to make sure that their children are getting all the necessary amounts of the foods from the different food groups that are needed. With most of their